Hi everybody, it's Dr. Julio Novoa.
Hi everyone, it's Danielle.
Just a quick update. Danielle's almost at 33 weeks, and she's been taking a few days off because of preterm contractions. Today she felt a little bit better, so she decided to come into work today. So luckily she got time off from her boss. So.
Yeah.
So anyway, we wanted to do a quick video. I've been getting a lot of questions related to something that I posted yesterday, and I think you need to take some notes. And this is for everybody. So any woman that has gone to the gynecologist, I want you to take a few minutes, take a pad, and write this information down because I think it's really important to clarify something or a few things. Number one, I'm sure that except for the pap smear that you guys have done, which is done anywhere between 3 to 5 years now, some patients have had procedures done such as colposcopies, which is a more advanced evaluation of the cervix. Some patients have had LEEP procedures done, which are to remove abnormal tissue from cervical anomalies. And some patients have had procedures done in the office such as Novasure, which is endometrial ablations, or Essure, which is the placement of permanent sterilization devices. What I want patients to understand is something very important, a few very important points. For all of these points, all of the things that I talked about, the informed consent cannot be signed off by the medical assistant, cannot be discussed by the medical assistant without a full evaluation and discussion with the doctor. So you can sign the informed consents, but all of those questions and everything in the informed consent must be signed off by the doctor. So if your doctor does a quick in and does the procedure and leaves, and you didn't have a chance to ask him any questions, or he didn't go over those questions on the informed consent, that doctor has failed to properly get informed consent. So it can't be delegated to another person, especially not a medical assistant and not a nurse. So if you remember or had a procedure done where you don't remember the doctor having discussed any of those points with you, the doctor failed to get informed consent, despite the fact that you signed the document, signed the informed consent. So keep that in mind as number one. Point number two. When you have a procedure done in the office, most doctors that are doing more invasive procedures, such as LEEP procedures, such as Novasure procedures, such as Essure procedures, are giving patients cocktails of medications. Sometimes it's oral, sometimes it's IM or intramuscular, sometimes it's IV. If a doctor is giving you any such cocktail, most of the 50 states require some type of office-based surgery permits or office-based anesthesia prior to giving a patient anything greater than a Tylenol or a Motrin or using local anesthetic. So these are generally based on what's called levels of anesthetic or anesthesia. Level 1 to level 4 are generally what we use here in Texas, but they also apply to many states, including Florida, for example. So let's just talk about Texas and Florida. If a doctor gives you anything greater than a Tylenol or a Motrin or something that you can get over the counter, the doctor must have a permit for that. Okay, so if you got a cocktail of medications such as Xanax or an injection or Valium, for example, or an injection to calm you down, to make you feel more comfortable, or you got a cocktail of pain medication, the doctor has to have a permit for that in most of the 50 states. Now, it's important to clarify that with your state medical board, but a lot of doctors are not getting these permits. A lot of doctors are not set up for what's considered to be level 2 to level 3 procedures, and this is in violation of state law, violation of the medical board regulations, and in many cases can be sanctioned by the doctor's sanctioning body of the American Board of Obstetrics and Gynecology. So please keep in mind, if you remember that your doctor gave you a cocktail of medication to calm you down or for pain medication, you can ask in your medical records, I want a copy of my doctor's permit to be able to have given me this medication. I want a copy of the, for example, some advanced cardiac life support, because most states require that if you're going to give a cocktail of medication. And what's happening is a lot of doctors aren't getting these permits, or are not ACLS certified, do not even have what's called the crash cart, which is mandatory. Now, this is more important related to LEEP procedures, Novasure procedures, and Essure procedures. So I want you to take the time to look at your medical records And also take the time to ask for these medical records and the licensing and permits from these doctors, because there's a lot of doctors that are not doing what they're supposed to be doing, and they're putting your life in danger a lot of times. And again, I keep saying a lot of times, and I'm saying it's happening more often than you think, because to get certified, to get the permits, to get the crash cart, can cost a practice several $1,000s a year, and most doctors are just not doing it. And the medical boards are too busy to go and inspect every single practice. Now, in Florida, it's a different situation. Florida has the health department, but even the health department is overwhelmed by things that they have to do. So the priority of checking medical offices for a crash cart or ACLS certification is pretty low on the priority list. So it takes the patient, and it takes a group of patients to ask those questions and to make sure that your doctor is doing what's in the best interest of you and of the community, which means that they have to follow the regulations. So take the time today, if you have, to call your offices, to call your GYN offices, and ask for that information, because it's, and again, depending on the state that you live in, it's mandatory, and we have it. We have our ACLS certification here. I have a crash cart that's up to date, and of course I've got my permit. So this is very important, especially for patients that have suffered through procedures such as LEAP, suffered through Novasure, suffered through Essure in the office, because most of the time if you're suffering through it, it's because the doctor is not giving you the proper amount of medication, and it's probably, or more often than not, because the doctor does not have the certification and permits that are allowing that doctor to give you a cocktail plus IV sedation. So keep that in mind. Please spread the word. I want to clean up the practice of OBGYN, and how we start and how it's been moving from Essure is that I've been finding out that a lot of practices are not doing the fundamental things that are necessary to keep their patients safe. And they're doing it because it's easier to do and more lucrative to do procedures in the office where you get paid more rather than do them in the hospital. And that we should not be driving our practice based on profits. It's always about the patient. So if you can't or don't have those permits, don't have the crash cart, or don't have the certification at ACLS, those procedures should be done in a hospital setting. All right? So thank you very much. If you have any questions, feel free to contact us through Facebook or through my email is drnovoa.nms@gmail.com.
Bye.
Bye. Take care.